Hello, these are artificial intelligence-generated voices, but the words read were created solely by humans using artificial intelligence for some of the writing, as well as Microsoft's Clipchamp to generate the voices and the podcast recordings.
Welcome to today's episode, where we'll dive into one of the most critical components of disaster response, Emergency Support Function Number 8, Health and Medical. I am Mike Prasad from the Center for Emergency Management Intelligence Research, and I'm joined by Patricia Frost, Vice Chair of the National Pediatric Disaster Coalition and former EMS Director for Contra Costa County. Thanks again for virtually sitting through these podcasts.
Thanks. I'm actually excited to share how pediatric care subject matter experts in children's hospitals are partnering with the EMS for Children program to create a real-world regional pediatric capability across healthcare systems and communities. In the United States, Pediatric Disaster Centers of Excellence were funded in 2019 by ASPR to improve multi-state regional pediatric capability. These include Region 5 for Kids, the Western Regional Alliance for Emergency Management, RAP-EM, and shortly after Gulf 7 Pediatric Network. This was followed by the HRSA-funded Pediatric Pandemic Network in 2021, whose vision is for all children and families to receive high-quality, equitable care in everyday emergencies, disasters, and global health threats. These first-of-its-kind entities create one of the largest collaborations launched by federal medical health administrations to address the unique needs of children during health emergencies, which often don't get the attention they deserve.
That's right. Adults, including those with access and functional needs, are typically considered the priority population that health and medical coalitions plan around. Emergency planning stakeholder collaborations frequently leave the needs of children as an afterthought. This is surprising to me because no community official, emergency manager, or healthcare executive wants to stand up in public after tragedies involving any kids and then admit their disaster or mass casualty plans failed to address the needs of children.
Exactly. I find it ironic as well. Children's unique needs are similar to those of other vulnerable populations that healthcare systems routinely plan for and with. Children have access and functional needs related to their age and their developmental level. Infants, toddlers, preschool, and school-age children rely entirely on caregivers for all their physical, safety, emotional, and nutritional needs. The difference is that most of that planning falls on the parents, childcare providers, and schools, who are not routinely part of a hospital or healthcare coalition planning group. One of the biggest challenges is the lack of awareness about how much access to pediatric care across the nation has changed over the last decade. For example, while children's hospitals, which have the highest capability to treat seriously ill or injured children, make up less than 5% of all hospitals in the U.S. At the same time, pediatric inpatient units across the U.S. have decreased by more than 19% in the last decade, with rural areas experiencing a 26% decrease. So in large-scale emergencies, kids may have to be transported long distances to access the care they need.
Welcome back. And in a time-sensitive situation, that's a major issue. Didn't I hear that there is a new accreditation requirement for all trauma centers, regardless of designation, to participate in the Pediatric Readiness Program? What protocols or preparations should community emergency rooms have to handle children in those initial, critical moments?
That's a great question, and yes, the American College of Surgeons requires all trauma centers to assess their pediatric readiness and develop a plan to address any gaps. The good news is that there are expertly vetted pediatric readiness checklists for hospitals and pre-hospital agencies to conduct self-assessments. The PEDS Ready program has compiled pediatric ready toolkits to address any gaps that may be found during those self-assessments. In addition, the American Academy of Pediatrics has developed a hospital disaster checklist that covers challenges like reunification of children after a mass casualty event. These 3 checklists can be found in the notes of this podcast.
Emergency managers and healthcare coalitions should know their community pediatric readiness scores and support activities to improve them. You mentioned the disaster checklist even covers unaccompanied minors, which is known to be very challenging, especially in the chaos of a mass casualty.
Definitely. In a mass casualty situation, you might have children arriving at an emergency department without their parents or guardians. Hospitals need specific protocols to manage and ensure the safety, well-being, and emotional needs are met, and have a written and exercised reunification plan to reconnect children with their families. The good news is that Region 5 for Kids has created a hospital reunification online training And the American Academy of Pediatrics has a toolkit to help any hospital jumpstart their effort.
And during the triple-demic of 2023, I remember some states had to implement Pediatric Medical Operating Coordination Centers or PMOCCs. Can you explain how those worked?
Yes. Those PMOCCs were essentially regional transfer centers with real-time bed capacity data staffed with pediatric emergency subject matter experts to help allocate pediatric beds to children with the highest need. Regional children's hospitals and their community hospitals had to come together and develop protocols that prioritized beds at the pediatric hospitals for only the sickest of children. This sometimes resulted in sending children hundreds of miles away, including out of state, to receive the life-saving care they needed. During the respiratory surge known as the triple-demic, we saw ERs and ICUs overwhelmed with kids suffering from RSV, flu, and COVID-19 all at once. The coordination centers helped direct children to the right facility, especially since not every hospital was equipped to handle complex pediatric cases.
That's so important. And it highlights just how variable access to care for children can be depending on where you live.
Exactly. If you're in a rural area, you may not have immediate access to a children's hospital, which can become life-threatening in a disaster. Emergency planners and medical responders must recognize that in their planning. Knowing which facilities have pediatric expertise and how to access systems to transport children quickly if needed is so very critical for life safety.
So, the big takeaway for emergency managers and responders is that children can't be an afterthought in disaster planning, especially regarding health and medical response. We need to engage the pediatric community, including state EMS for children programs, the Pediatric Disaster Centers of Excellence, and the Pediatric Pandemic Network, PPN, in ensuring community EDs are prepared, protocols are in place for pediatric care, and resources are coordinated effectively.
Exactly. And that preparation saves lives. A recent study showed that emergency departments with low pediatric readiness scores have a 4-fold increase in mortality rate. By including children's needs in our planning, we ensure they receive the right care at the right time, even in the most chaotic circumstances.
Such an important message. Thank you so much for sharing your expertise today. This conversation will help emergency managers think and even action differently about health and medical planning for children and connect to initiatives focused on meeting the needs of children under all conditions.
Thanks for having me. I hope it sparks more conversations and actions to ensure our healthcare system is ready to care for all populations, including our youngest and most vulnerable.
And that wraps up this episode on ESF number 8 and the critical importance of pediatric care during disasters. Our next episode number 9 is on ESF number 9, Search and Rescue. As always, please make sure to include #PrepForTheKids for the kids when posting social media about our campaign. Thanks for listening and helping prepare for our kids.
Please visit us on the web at npdcoalition.org. Our vision is to support the development of a unified medical and health emergency management community to prepare, respond, and recover from emergencies and disasters.